One of the most difficult things to get through to upper cervical chiropractic patients is the process of healing. We grow up in a healthcare system that is largely symptom-based, and so they are into diagnosing you and naming you and then giving you a medication to treat your symptom. And so most people in our culture, they know nothing about natural healing and how the body goes through a recovery process when you remove obstacles to healing. So what I want to talk about are kind of what happens as people go through life, how the body adapts to injury, and how when patients come to the office 10 and 20 and sometimes 50 years after many different traumas, why they may get some symptom relief right away, but the body goes through this up and down protracted healing process. So first, let's just talk about injury. So let's say you're 5 years old, or let's say you're 7 years old, you get your first BMX bike, you go off a jump, and you end up endoing over the handlebars and you hit your head into the concrete, and the joint between the head and the neck dislodges. And so let's first talk about joint anatomy. Around every joint in your body, there's a very fibrous ligament. It's called the joint capsule. It gives the joint integrity. And so when you have an injury in a joint, if there's enough concussion of force to dislodge that joint, it tears the joint capsule, the vertebra gets locked out of its normal position, the muscles in the upper neck lock down, and you lose motion in the joint, and more importantly, it doesn't correct itself. It heals up in that bad position. Now, that first injury that you happen, because the upper cervical spine controls the postural muscle tone through the whole body, when that joint locks out of position, the postural muscle tone through the body becomes imbalanced. And so a lot of times you'll see someone with a high shoulder, the head off center, one hip higher than the other. And so that initial adaptation, person can have tightness and imbalances in the musculature and pain in different areas. And then the body gets used to that out of balance state. Maybe at 18, they get in a car accident and they have another injury. Maybe at the third cervical, the joint dislodges. There's another layer of adaptation and balance in the system. And most of the patients that get into an upper cervical office, they've had multiple injuries throughout life, like most people. And they come in with chronic conditions, whether that's vertigo or neck pain or headaches, insomnia, depression, low energy, cognitive problems, low back problems, sciatica. And so they come into us at 40, and they've had 3 different layers of injury, and we take a 3D imaging of the neck to see how they're out of position. We make that initial correction to get that segment or that joint that's locked back into motion. And initially what happens is the muscles have been locked down, they start to relax, and in most of the cases they start to get some relief in the pain. Their energy may do better, they may sleep better. And so imagine there's 3 layers of adaptation in the muscle tone through the spine. It's not like the body just goes back to where it should be and everything clears out. The body's got to go through this unlayering process. And so many patients that come in for care, initially they get a big change in the symptoms, and then the body, they start feeling all these migratory different pains that migrate through the system, and that's muscle groups that are starting to engage to try and straighten the posture out. And so if someone comes into the office and they're 60 and they had an injury when they're 5 years old, and they had another one at 15, they had another one at 25, and they get into the office at 50, there's been 45 layers of adaptation from the first injury, and decades from the second one, and maybe 15 years from the third injury. And so you can't expect the body just to snap back where it should be. They're going to go through a roller coaster. It's going to be up and down process. You're going to have periods where you feel really good and you think you're out of the woods, and then all of a sudden you go through another period where you get a lot of muscle pain and migratory stuff, and your energy's a little low as the body's using energy to try and heal, mend, and repair. So my main point in making this video is to let patients know that healing doesn't happen overnight. It happens episodically, and depending on how much injury you've had and how much time it's been there and how much adhesions there is in the muscles, it takes time for the body to unlayer that. So be patient. Do know that you can go through ups and downs. Do know that you're going to go through periods where you think you're out of the woods, and then all of a sudden the body will go back into more repair. Healing takes time. It doesn't happen overnight, but if you stay with the process and you continually get checked and you stay clear of the upper cervical misalignment, nature and your body will do the best that it can to get you back to as close to health as possible. So hope this video helps people understand natural healing from an upper cervical chiropractic perspective, and it'll get people who are under upper cervical care to stay the course long term so you can get the most benefit out of the care that you're receiving. And then the other take-home message is, once you're back to how you should be, you should get it checked periodically, kind of like a dental checkup, to make sure that you're in place, whether you feel good or bad, because if you do have a misalignment, let's get it corrected before you feel bad and start heading back downhill and back to where they started. All right, hope this makes sense.